you can get too much water. You can get too much anything. Yes, you can get too much anything. And look, some people are more sensitive than others. What would I just do with that lady? Oh, I was telling her, here, my usual, it's a lady I went to elementary, middle, and high school with who sees me as a patient.
Okay.
And I don't really consider her a lady. I consider her a girl because I just think we were still kids. But so, she's super sensitive to everything. And I just saw her and I said, hey, my usual dose of this is two twice a day. You start with one a day. Just see how it goes. And keep in mind my usual dose is two twice a day, and you adjust this at your dosing schedule. So there's no way on God's earth she's going to be able to take two twice a day what I gave her because she's just super sensitive to things.
Okay.
And so I recognize that. And so when we're talking about 25 milligrams, like most of my patients are on 25 milligrams per
Okay.
day. I don't I don't have a practice where I'm just doing iodine, where I don't see patients, I don't talk to them, I don't do a physical exam, I don't do lab work. I'm like, hey, nice to meet you. Go take 25 milligrams of iodine, see you in 6 months. And that's not how I do things. And so everyone's individualized. Although I can tell you the vast majority are on 25 milligrams. If they have glandular disease, thyroid, ovaries, uterus, breast, prostate, pancreas, I'm missing one of those glands. But if they have glandular disease, I'll use more. And if they have cancer, sometimes more. And not everyone can tolerate that, and you just individualize it. So, so selenium. So I do, when we see patients, we all have our own. There's six and a half practitioners. My younger daughter's finishing her residency and will be there full time soon. But when we see our patients, we do a full hormonal and nutritional workup. So we're looking at
Okay.
selenium levels and magnesium levels and B6, B1, B2, B3, all the levels. And we're trying to optimize the deficiencies sort of together. So
Okay.
iodine's rarely used as a single nutrient. That's all we're going to do. I don't know if I've ever done it that way. I finished residency. I'm a conventional doctor. I tell people I never prescribed vitamin. I never took vitamins growing up. I grew up in a conventional household. We got sick. We went to the doctor. We took what they took, what they gave us. We never questioned anything medically. I would love eating McDonald's back in the day. I eat fast food, and I never really paid attention to my diet. And I had bad asthma. I was on puffers and going to the ER every few months for steroid shots, and I was sure asthma was going to kill me at a young age. I had really severe asthma, and so I finished my residency, and my turning point came about 6 months into practicing, when I'm in a busy family practice office, and in this area, and it was strict conventional medicine, just like we were taught. And we were seeing, I don't know, a lot of people a day, just like we were taught. So I was spending 5 minutes with them, not asking about their diet, not concerned with what they're eating, just trying to prescribe the drug to treat the diagnosis that I made at that time, since that's how I was taught. But I was doing this for about 6 months, and I just realized it was 3 nights in a row I didn't sleep well. And first time, and I didn't sleep much at all. And I wake up to go to work, and I got this anxiety that's sort of taken hold of me. And Allison and I are getting dressed together, and she's getting ready to go to work. And I said to her, I don't want to be a doctor anymore. So here I am, the end of my residency. I'm 29, and we had $100,000 in student loans. And she looks at me and she goes, "What's wrong?" And I'm like, "This sucks. All I'm doing is prescribing drugs, spending 5 minutes with people. I mean, I said I'm not helping them unless they have an infection. I'm not helping them.
Right.
And I'm having to use more drugs to treat the side effects from the first drugs." And I said, "I can't do this for 30 years." And she said, "What are you going to do?" And I said, "I don't know." And she goes, "Why don't you do another residency?" And I'm like, "No, no, one of those was enough." And so I was floundering. And that day at the office, like, I'm tired, I'm anxious. I see this patient, and his wife worked with Allison. They drove downtown Detroit together for their job, and we were friendly with him. And he kept bugging me to meet this chiropractor. And I didn't want to meet a chiropractor. I never referred to chiropractors. I said they were dangerous. I never met a chiropractor in my life. I never went to one. I didn't know what the philosophy was.
Sure.
I We were taught they were dangerous, and no one should see them. So I had shoved him off over this, but in this anxiety, and he wanted to meet the chiropractor not because he was adjusting him, because he was doing nutrition on him, and he said that really helped him for his problems.
Mm.
So I took his name, and I remember at lunchtime that day, I left him a message. Hey, let's get together for dinner. And he calls me up that night. We schedule a dinner for the following Tuesday. Tuesday rolls around. I get home from work. I said to Allison, I'm going to cancel dinner. I really don't want to meet this guy. And she said, "That's rude. You need to go. You already scheduled this. It's too late." And As I'm walking out the door, she said, be nice. So I went, his name was Dr. Robert Radke. He starts talking about functional biochemistry and nutrients and how they're required for all these biochemical pathways to work right. Now, I had two courses of biochemistry. I had one at the University of Michigan, defending national champions, and I had one in med school. And I got A's in both. I was good at biochemistry. I was good at chemistry. I got A's because I could memorize things and spit it back out, but I didn't really understand it. I didn't understand functional biochemistry and how it impacted somebody like you as a patient of mine. I was just like astounded. First off, he's smart. He's a nice guy. He knows more functional biochemistry than I did. And I thought that's really interesting. I wasn't taught this in med school. And he brought me a book at that meeting, Healing with Nutrition by Jonathan Wright, who was an allopathic physician. So I took the book home. I read the book till late at night and I went to bed after 2 a.m. Now, remember, I hadn't slept well during that time period. Now I'm kind of jacked up and excited. Before I go to work, I called my dad that morning and I said, hey, can you, it was before cell phones, so I couldn't call him from the car. But I said, hey, can you come in the office this morning? I want to draw some blood tests on you. So based on what I talked about with Dr. Radke, based on what I read in that book, I drew two things on him. I drew a full thyroid panel instead of just a TSH level like I was taught in med school. And I drew his testosterone levels. And my dad's testosterone levels below detectable limits when it came back. And his thyroid levels were in the reference range, but in the lower part of the reference range. So I put him on a natural thyroid hormone, natural testosterone. And within 7 days, his 20 plus year history of angina, continual chest pain. Anytime he did anything, he'd get chest pain, pop a nitro pill. It went away. Calls me up after a week and he says, hey, I didn't have angina today. 30 days later, I recheck blood work on him and his cholesterol, which was stuck in the 300s for 2 decades or 3 decades or something, on medication, falls below 200 without changing any of his bad habits. And his numbers all looked better. His whole chemistry improved. And more importantly, he looked better and acted better. You know, people were asking, what are you doing? He started to be able to lose weight for the first time. And, you know, once I saw the changes in my dad, I knew that's what I wanted to do in medicine. So from that moment on, I started checking people's hormone levels. Really, everyone gets a full hormonal and nutritional evaluation when it comes to CR practice. And hormonal evaluation is just, it's what's done. That's what I did with my dad. That's what everybody gets.